Welcome to Study Topics. This week we're going over ankle ligament testing. If you need help with your handling skills, make sure you grab a partner and practice all of these scenarios. Hello and welcome to Study Topics. This week we are going to be covering common ankle sprains. This is a highly examinable topic because it's one of the more common musculoskeletal injuries seen in private practice. So let's start by going over some mechanisms of injury. So here's a quiz for you. Can you identify which mechanism corresponds to each sprain type? We have lateral ankle sprain, syndesmosis ankle sprain, and a medial ankle sprain. Take a few seconds and see how you do. All right, here are the answers. This one should be pretty easy. If we take a look at the lateral ankle sprain, that corresponds with two, inversion and plantar flexion. When we see a syndesmosis ankle sprain or a high ankle sprain, that's going to go with an external rotation of the ankle or excessive dorsiflexion and external rotation of the leg on a foot when it is planted. Next, if we take a look at a medial ankle sprain, well, it's going to be pretty much the opposite of what we'd see in a lateral ankle sprain. But the unique part about a medial one is it's often a gradual degeneration of the ligaments. Again, or it could be a valgus force of the leg creating eversion or an awkward fall resulting in excessive pronation or eversion of the foot. All right, next question. Can you identify each of the following ligaments and whether they're considered a lateral ankle ligament, a syndesmosis ankle ligament, or a medial ankle ligament? I'll give you a few seconds. Just write A, B, or C down beside each one. All right, this one is a little bit trickier. I love getting our students to try to compartmentalize their knowledge. So a great way to learn these ankle ligaments is to put them into categories. So I've gone and done that for you. If we look at the lateral ankle ligament, we can see the ATFL and CFL belong there. There also are other important lateral ankle ligaments, so make sure you look those up. In the syndesmosis ankle ligaments, we can see the transverse tibiofibular, the interosseous, and the anterior transverse tibiofibular ligament. Whoa, quite a mouthful. If you take a look at the medial ankle ligaments, we would see tibionavicular, tibial calcaneal, and the anterior tibial talar ligament. Now again, there are more important ligaments than the one that I put here, but I wanted to test you just on these. Okay, can you fill in the blanks and tell us which pathology is being described? This is definitely a bit tricky because these are some weird and wacky sprains. Okay, if we take a look at the first one, we'll see that an injury causing separation of the bones of the first and second metatarsals leading to forefoot instability is called a Lisfranc injury. You may see this as a Lisfranc sprain or a Lisfranc fracture, but it's pretty much anything causing separation to the base of the first and second. Next, if we look at a fracture on the base of the fifth metatarsal, and again, this is often caused by that excessive inversion of the foot, this is called a Jones fracture. Now remember, how you can remember this is Jones is spelled with 5 letters, which corresponds to the fifth metatarsal. As a bit of a bonus question, feel free to post in the video notes below if you know what attaches to the fifth metatarsal in the foot. All right, and last we have proximal fibular fracture that occurs with a Volgin fracture of the medial malleolus and a rupture of the deltoid ligament. This one's a little bit tricky. It's called a Maisonneuve fracture, and I've probably butchered how I'm saying it. This is a really tricky one, and truthfully, we're not expecting you to know the name, but we do want this to bring to your attention that you should always check the proximal fibula after a medial ankle injury, okay? Kind of weird, right? All right, did you get number 3 right or this question right? Let me know. Thanks for joining me.